For conditions like neck pain and low back pain, it's only human nature to want to find a suitable solution to provide relief in the convenience of your own home. This is why, as a chiropractor, one of the most common questions I get asked is, can an inversion table help me? This is Q&A with Dr. J. I'd like to take a crack at it. First off, the short answer to this question is typically yes. Inversion therapy can be a very beneficial thing to help take care of the joints and discs and tissues of your spine, and can oftentimes aid in not only providing relief, but maintaining a level of comfort for many, many months or years at a time. The reason for this is, through normal daily use, gravity will push down on our body, and because these cartilage discs are made primarily out of water, they can get compressed and thin over time, moving the joints closer and closer together. To show you what this looks like, I brought this model here, and we have one bone on top, a bone on bottom, and in between is that nice squishy cartilage disc. As gravity pushes down, that disc can get narrowed, and the hole created by the disc, called the intervertebral foramen, this is where the nerve exits from the spinal cord and travels to all parts of your body, providing all the function that you get from the action of that nerve. Not only does it move muscles and joints and allow for movement, but we have to remember and appreciate that tiny little branches branch off this big, thick nerve root, and they travel to all the other organs, glands, and tissues and keep your body not only alive, but functioning optimally. So it's nice to take care of your spine, keep it nice and decompressed and open it up, relieving the pressure that that compression can create and allowing for as much room for that nerve to float around. So again, as gravity pushes down, that disc can get narrowed and sometimes even begin to weaken and bulge right there, pushing on that nerve root. So the goal of inversion therapy is to put yourself onto a table, bend yourself backwards or invert the body upside down, and what this does is it uses the power of gravity in the opposite way. Rather than squishing the disc down and narrowing the opening for the nerve, it actually opens up the space provided by the disc, and it can relieve a lot of pressure that's associated with these types of compression disorders. So there you have it. Inversion therapy can be a good thing, but just like any therapy or service, there are risks associated. Before you start to incorporate something like inversion into your daily routine or weekly routine, you have to research and talk with your care providers to make sure that this is not going to cause any serious problems to develop. Some of the most obvious are heart and blood vessel issues. If you have any known conditions, obviously spending any amount of time upside down impairs the normal flow of blood flow and can even compromise the health of your blood vessels. So there are some serious conditions you need to be aware of when implementing something like this into your daily routine. If you found this video helpful, please leave a like and share it with someone that you know and care about. You never know who it's going to reach that could change their lives. If you have any questions about spine health or chiropractic, then please leave a comment below and I'd be happy to answer that in a follow-up video. Once again, this is Q&A with Dr. J. Have a good day.